Hi everyone, welcome back to Herky the Cavalier's channel. I'm here today with Herky and Milton and a very special guest. This is Dr. Rebecca de Arburn Parent, and if you haven't seen our latest video, our vet vlog, I'll be linking it here. She's the fabulous vet that was in that video with us, so I invited her over for a Cav Mom Talks, but she's not a Cav Mom. I hope you're okay with that. So welcome to our channel.
Thank you.
I asked you guys some questions on Instagram and on YouTube to see if you had something specific to ask, and I'm just going to go over some general questions and of course some specific questions that you guys had too. So I just wanted to know first and foremost how you chose to go into vet school and more specifically into surgery.
Well, obviously I always loved animals, and that's the main reason I went in vet school. I also love biology, medicine in general, so that's what got me in veterinary medicine. And surgery specifically, well, it was during school. I worked at the school clinic during the summers, and I ended up in that department like randomly, and I really enjoyed it. Kind of became my passion. So,
really?
Yeah.
That's really odd. I always find like going into vet school is something I feel like all of us growing up really love animals, and I wanted to be a vet when I was younger too, but I realized I'm very sensitive to blood, and I'm just a sensitive person in general, so I would cry like any moment, all the time. So it takes a very brave person, I think, to be able to go into surgery and things like that.
I don't want to say something too weird, but I kind of enjoy it.
It takes a special person.
She is special. She's definitely special.
That's why she's a specialist.
It's not really like the cutting or the blood that I enjoy, but mostly like having a problem that I can fix and quite fast compared to, let's say, dermatology or internal medicine. Usually it's chronic diseases. Sometimes it's going on for life. So they do an incredible job doing what they do, but what I like with my specialty is that you have a problem, you fix it, you see the patient a few weeks after, and then it's going well, he's going to have a happy life.
And so I was under the impression that you were an orthopedic surgeon, but she corrected me and she's just a specialized surgeon. So you do all sorts of surgeries, not just orthopedic?
Exactly. So we mostly do orthopedic because that's what dogs get most of the time. So cranial cruciate ligament rupture is the main condition we operate on. Luxating patellas are also conditions that we see really often. But we do soft tissue also, like mass removal or even abdominal surgeries, thoracic surgeries. That's my favorite. So we mostly do orthopedics, but if I had to choose, I would do soft tissue. Mainly.
I think I went on her Facebook page, and one of the first photos was like a huge mass. And it was so gross. Like I can't even scroll in her feed.
It must feel good to remove that mass.
Yeah, exactly. Just
like it's really satisfying.
You guys are all weird!
Because exactly, like it's big and the dog can eat with a mass big like that. So they come, you remove it, and the next day they eat. They are in the hospital for like 24, 48 hours, go back home. And that mass specifically is a liver mass.
So it was a cancer.
Exactly, but when you remove it, it's kind of curative. Like they can live up to 3-5 years afterwards. So usually we operate on dogs for that kind of mass when they're like 10, 12. So they usually die from something else because they have a long lifespan after the surgery, so that's good.
So the term orthopedic surgery, what does that entail?
Well, mostly doing surgeries on bones or soft tissue surrounding joints, let's say. Either fractures, orthopedic condition like the cranial cruciate ligament rupture or patellas, or sometimes it's limb deformities. So it's really like bone and joints mostly for.
So would like that like cranial surgeries, is that orthopedic also?
It would be more neurological. So we do that also. Like herniated disc surgeries, spinal cord tumors, let's say, or cranial mass. That would be more neurological. But it's true that you have to cut bones to get to the brain. So
I'm guessing the most common issues that you would see for ortho would be knees and hips.
Mostly.
And so what's the most difficult situation that you've been on your day-to-day job?
Well, being a vet, we deal with pets, but also with the owners.
Yeah.
And the thing that is the most frustrating, I think, for veterinarians in general is having to deal with the prices of
really?
what we do.
Okay.
On a day-to-day basis, I would say that's the most frustrating part of my job because I'm a doctor, I'm not a seller. So I don't enjoy that part because owners get emotional talking about their pet's health. They want the best for their dogs, and we ended up putting prices on that. So that's not fun for me.
Right.
I would rather
it'd be like humans and it's just like covered by everything.
Exactly.
That'd be great.
That would be the greatest thing that we could have. So pet insurance is really good for that.
I love that she's saying that. I was just going to plug pet insurance. Like we're strong believers of pet insurance, and when we went to the appointment, I don't want to say like I felt, but I kind of felt that the pricing of the surgery was a bit of a tough situation for you to talk to us about. And then I was like pricing is not an issue because we have pet insurance. And so I'm super grateful for that. And it's never going to cost us that much for Herky and Milton's health. So I urge you, please, to get pet insurance as soon as possible, because especially if you have Cavaliers, they have so many health issues and you're going to be covered for life basically. And you don't want an incident or an illness to stand in the way of your pet's health and the longevity of it. Because I think you also said that sometimes the price comes in the way the life of your dog.
We were speaking of a price point of $3,000-4,000 for a knee surgery, and not everybody. We certainly don't have that kind of money lying around.
No. Like if we didn't have pet insurance, it would be like a big decision for us.
Exactly. Most owners around here don't have pet insurance. And that's really a struggle. Like, and it changes completely the way we deal with things. Like on a specific case when there's insurance involved, because now we can just talk about the medical condition and what needs to be done for the patient's health and not thinking about
what is it going to cost if we do this and we do that.
That's really the most frustrating part of my job.
So if you guys didn't watch our latest video, as I mentioned, we consulted with Dr. Rebecca about Milton's knee, but turns out that 3 out of the 4 knees are luxating. So we had a big discussion at home, and this is a recurrent theme in our household right now. So, so I just wanted to invite Dr. Rebecca over to talk more about luxating patellas for you guys, for educational purposes. So a lot of questions were recurrent about this condition. So the most common question we get is, how do you know when you should consult with a vet or a specialist regarding patellas?
I would say, first, if you get a puppy, your veterinarian should do a full exam, like physical exam, and it should be also completed with an orthopedic exam until the patient is at least a year old. If it's a bigger breed, a little bit, well, when it's fully grown, because there is a lot of orthopedic condition and even any other condition that can develop while they are growing. If you know you have a breed prone to a certain problem, to make sure that it's not developing already, because just as with Herky and Milton, sometimes it's asymptomatic. So the patient might not have a lameness or any side effects from the specific condition, but if it's there, the earlier you manage it, the better.
And that's kind of a concern with us because we've been going to the same vet for 5 years for Herky and 3 years for Milton. And I feel like since we didn't ask specifically about knees, I feel like maybe like the exam wasn't done thoroughly enough. And do you feel like in our case we should have consulted with you before?
No. Having a patella luxation, if there's no lameness, most of the time we don't push for surgery, just like we discussed when you came to see me. So like it doesn't change anything that you didn't came earlier. They might develop a little bit of arthrosis like we discussed. There are long-term consequences that can develop but not always. So it doesn't change anything. Like we could operate now, it wouldn't change a thing that you didn't come earlier. If they would be limping for that long, then they would have more arthrosis now and stuff like that. So it would have been better to see your earlier. But your veterinarian didn't do a bad job not seeing it, because since there was no lameness, their patella is not really like super easy to luxate, so it's probably because of that that they didn't catch it, because that's my job. Like I do that all the time, palpating knees, and so that's easy for me to find, but I'm bad at getting a heart murmur, let's say. So everybody has their specialty. Exactly. I guess. So it's not. It's just that they're not orthopedic surgeons. So some are really good at ortho, some are really good at something else. With general practitioner, they have to be good at everything, but they are not specialized in anything. So like they cover the whole health and body, so that's not easy for them. If your dog would be limping, for sure somebody would have recommended.
Oh, for sure, of course. And so just so everybody knows what we're talking about luxating patella, I know during the exam you explained it to us like really long, but if you could just explain it to us like briefly. What is a luxating patella?
So dogs' knees are mostly shaped like us. So they have a femur, they have a tibia, and they have a patella. Most of the times with dogs, their patella luxate medially, so towards the inside, exactly. Some dogs, it's towards the outside. Small breeds, it's really mostly towards the inside. So that's what's happening. The patella is supposed to be right in the middle of the femur, but when it luxates, it goes towards the middle. If they have a lameness, most of the time it's because it pops out, and then their knee can't extend as it should because of that. So now they have a lameness until the patella pops back in and they stop having the lameness. So usually they up when they do have that condition. And
so I think that was another question, is how do you know if your dog has a luxating patella at home? Is usually it will be either the limping or the hopping.
Exactly. Correct? Yeah, and most of the time it's hopping with a luxating patella. But anyway, if there's a lameness or hopping, have somebody, a veterinarian, examine your dog too.
So when they hop, basically it's because the patella is not in the position, and they hop. They can't step on it until it's back in place?
It's mostly, yes, it's kind of a mechanical issue because the knee doesn't work as it should. With dogs that have more advanced luxating patella, they kind of figure it out at some point and they use it anyway. So there are 4 grades of luxating patella, depending on how bad it is. Some dogs, they live with grade 4, which is the worst their whole life. And their patella is always luxated, so they have to walk at some point on it. When they have a lameness, usually it's because the patella is out. At some point it comes back in, and then the lameness goes.
Question number 1. Can dogs live comfortably with a grade 3 or 4 luxating patella without surgical intervention?
There is a lot of dogs that live with grade 3 and 4 luxated patellas. They would do better with their patella where it should be. But we see every now and then dogs that have grade 3 or 4 that lived like that for a long time, and we discussed it when you came to see me. Usually when we see them at 5, 6, when they come to see us, it's because they developed a cranial cruciate ligament rupture. So grade 3 and 4 luxating patellas, well, any grade probably predisposed to that condition. So they can live comfortably, but they can also have consequences on the long term from that condition if it's not treated. So, and
if I remember correctly, the percentage is 20 to 25% chance that it will happen.
Exactly, when it's a grade 3.
Do you have tips to encourage a dog to use a leg operated on for a luxating patella or ACL?
If they want a trick to use more rapidly the leg that's been operated on, it's one, to make sure that the medical management is good, because sometimes it might be just because they don't have enough painkillers or anti-inflammatories. So that would be my first thing that I would recommend. On the long term, an operated luxating patella that is a success, or same thing for CCLR, the cranial cruciate, they shouldn't have a lameness. So if they do, consult with your veterinarian. It's not normal. If it's for the other leg, if it's totally normal, well, they should use it normally.
Okay.
So if there's...
So naturally they will just tend to use it more?
Exactly. When we operate just one leg and then the other after, usually they put their weight on the leg that hasn't been operated for the first 2 to 3 weeks sometimes. And then rapidly they switch to the operated leg because now it becomes the better leg.
Oh, okay.
What can be done to prevent hip and patella issues for Cavaliers?
So I think the answer to this is going to be that it's genetics, right?
Exactly.
So there's not much you can do about it. I think that's an upcoming question too, but do you feel like supplements help with that?
If they have those conditions, yes, supplements can help slow down the evolution of arthrosis. So we do prescribe supplements for cases of hip dysplasia or luxating patellas. It's better to have them fixed. But let's say for your dogs that don't have a lameness, and then supplements is really good to slow down the possibility of having arthrosis on the long term. But you're right. My answer would be it's genetic, so make sure that your breeder or the dog when you get it doesn't have those conditions.
Usually puppies, is it true that you can only see if they have luxating patella at about the age of 8 months old?
It can be a little bit earlier than that depending on the grade, how fast it develops, but it's true that when you'll adopt it at 8 weeks, usually they will have normal knee. So you can't know if the puppy is going to develop it, although you can know if parents had
so a tip
patella.
Basically for when selecting your breeder is to make sure that the parents and sometimes even grandparents have the orthopedic papers to say that they don't have luxating patellas.
Yeah, exactly. That's what I would recommend.
So that's a tip to choose your breeder.
Regarding supplements, should this be given even if a dog does not have any symptoms, and at what age can you start?
Really depending on the supplements we're talking about, but the ones we use most often is Cartrophen. I don't know if you've ever heard about that. And well, there are glucosamine supplements, there are collagen supplements too. So if we're talking about those big families, you can, because there are no side effects usually associated with those supplements. So, and most of the time it's made out as a treat. So it's really easy to give, no side effects. So why not? Will it like totally prevent arthrosis from developing?
Probably not.
Usually it slows it down, and also some supplements have anti-inflammatory effects. So it's good for the dog also, so it's totally fine to give it even if they don't have a lameness.
Herky and Milton, they do take supplements like for hip and joints. And I'm gonna show you after, like, but it's that vet that I was telling you about in LA. She has her own company of supplements and stuff, so we've been giving them that. I don't know if it helps in any way. I really don't know, but I mean, if it doesn't hurt, like you say, and it doesn't do anything, then I think why not?
Exactly. Most of the time you don't see like you give it and then the dog is doing so much better. It's on the long term you're working. So like on the cartilage, if you look at with a microscope, it's going to have a better like surface.
Are there any tests that you could do at home with your dogs to check if they have knee problems?
Well,
she's laughing.
It's just that, just like as we discussed a little bit earlier, Herky is 5 years old, right? And I just diagnosed her with luxating patella. Like we didn't know before I examined her knee that she had it. So even general practitioner can miss it. So it's quite difficult to explain how to diagnose that at home. I wouldn't recommend it. Have your general practitioner look at it. If they don't feel comfortable diagnosing it, they should tell you if it's something you're worried about. If your dog has a lameness, have it checked out for sure. If they don't, then if you're worried about, I would recommend seeing an orthopedic surgeon at some point if you really want the answer.
I was just telling her before we started filming that I was rewatching the video where she examined Herky and Milton, and I was trying to see what she was doing to do it on Herky and Milton, and I had no idea.
They have years and years of training for a reason, guys.
A patella of a dog that big is kind of like big like the tip of
Okay.
Oh, really?
my little fingers. So
Okay.
it's really, really tiny.
Okay.
So even that, just putting your fingers where the patella is not that easy.
Yeah, because when I feel it myself, I'm like, there's so many bumps. And
Exactly.
like, I have no idea what I'm touching right now. And at the appointment together, you're like, can you feel it? Like right here? I'm like, no.
Feeling it is difficult. Yeah. But the patella, if you want, it's like right there. That's
Here?
this. Yeah.
I don't know
This
what I'm
bony
touching, you
part.
guys.
And Herky is jealous. She's
Yeah.
like, that's fine. Okay, I'll touch yours.
Okay.
So just so you know, dog legs is a little bit different from us, mostly because they don't walk on their whole foot. They walk on their tiptoe. So the ankle is here, so the knee would be here, and the hip is right there. So knee is here. The patella, well, you have to palpate the two bones that makes the knee first. So you have the end of the femur that is here, the beginning of the tibia that is here. The patella is on the femur, so it's right there, that little bony part right there.
Okay.
And if you want to make sure you're at the right place, right after you should have the patellar tendon. So there is like a big cord attached to the patella going down and attaching on the tibial crest.
Okay.
So patella is right there. Well, now it's luxated. So if you put it between your two fingers, yeah, right there, you kind of add the little bony part. So move it back in. There you go. Now it's back.
Oh, fuck.
Holy Oh my god! That was so weird!
You see when she's lying down like that and not putting weight on it, so now it's luxated, you put it.
Oh my god, this is so weird.
And when it's luxated, you can feel the femoral trochlea. So where it should be, like you feel the groove. And it's not like uncomfortable reading, like you see. So it's mostly a mechanical lameness when the hopping, because you can luxate and put it back in, and they don't really do anything.
Okay.
Regarding home stuff, is it bad that your Cavalier is jumping on and off the bed, on and off the cars? Is it bad for the back and their knees? And another person asked, if I live in a third floor apartment, should I be carrying my Cavalier up and down the stairs, or is that good exercise for them?
All these things, every dog does it. So, and not every dog has orthopedic issues or back issues. So I don't necessarily recommend all dogs not going in bed. Anyway, that would be sad.
Yeah.
Or couch, same thing. I mean, why have a dog if you can't look at TV with your dog? But if you know that your dog has an orthopedic condition or a back condition, then yes, prevent it. Put them on the couch, put them down. But if they are totally fine, there is no point in preventing it. Like, they are supposed to be able to jump that high. If you want to make sure that nothing happens, you can do it, but it's not because they do that they will necessarily develop orthopedic or back issues.
And when
So even for the car,
the car,
it's a bit high.
well, it depends. If they jump like where you put your feet, it's not that high. If they jump like really on the seat, it might be a little bit high, depending on the dog again, because some dogs are really good jumpers, like our pug can do that.
And show dogs are just running.
Yeah, exactly.
But so when you say when they have an orthopedic condition, like let's say Herky and Milton, they're a grade 2 luxating patella, do you think it's still good? Or is it still okay that they do those kind of things?
I don't mind if they do it.
Okay.
Like, it's totally fine. It shouldn't create any problem. I would be surprised.
Okay.
And if it does, it's probably because it would have happened another way. Yeah.
Because you had mentioned that there was a dog with a grade 2 luxating patella, and then he just jumped off the couch, and then he had the ligament rupture.
Yeah, exactly.
So it could just be a freak accident too.
Well, this dog was like 8 years old. He's had that luxating patella for that long.
Okay.
So it's mostly that. It's because every time the patella luxates, there is an internal rotation of his tibia. It puts a lot of pressure on his cranial cruciate. So 8 years down the road, at some point it just break. But it's not because of the couch. It would have happened running after a squirrel or anything like that at some point, probably with him.
So I think this will wrap up the video for now. I think we've been talking about knees for a long time. So thank you so much for watching. I'll be linking Dr. Rebecca's Instagram and Facebook accounts right here on the screen and also in the description box below. But if you want to have her back on the channel, please thumbs up this video and let us know what you want to talk about with her. She's so amazing, and I think she's very, very helpful. And so yeah, let us know if you want her to come back. So thank you so much for coming on the channel. So
Thank you.
We'll see you soon.
Bye.
I think the most recurrent question, basically.
That's
C'est
going
pas
in the
live.
bloopers. If you dislocate your knee, I know it was.
Big families. Well, I forgot the question.